As the theater lights blaze, illuminating the surgical stage, a surgeon's hand, steady, proficient, poised, makes its initial incision. This is no ordinary theater, but the site of a life-altering performance, the birth of a child by cesarean section. Understanding cesarean section. The cesarean section, often simply called a C-section, is a surgical procedure used to deliver a baby through incisions in the abdomen and uterus. Why choose a C-section? C-sections are often performed when complications from pregnancy make traditional vaginal birth difficult, or put the mother or child at risk. These can include health issues such as high blood pressure or infections, complications in the pregnancy like placenta previa or breech position, multiple births, twins, triplets, etc., or if the mother has had a previous C-section. That said, elective C-sections, those not medically necessary but chosen by the mother, have also become more common. These can offer certain advantages like planning the birth date and potentially reducing the risk of pelvic floor issues. The procedure, step by step. A C-section begins with the administration of anesthesia, usually a regional anesthetic that numbs only the lower part of the body. An incision is then made, typically horizontally across the lower abdomen, also known as a bikini cut, though in certain cases a vertical cut may be necessary. The doctor will then reach into the abdomen, open the uterus, and guide the baby out. After the umbilical cord is cut, the baby is checked by pediatricians while the surgeon delivers the placenta and closes the incisions. Post-procedure, recovery and beyond. Recovery from a C-section, while generally safe, can be more challenging than from vaginal birth. Pain at the incision site, bleeding, and potential reactions to anesthesia are all possible. There's also a higher risk of longer-term complications such as infection or blood clots. Many women are concerned about the impact of a C-section on future pregnancies. While having a C-section can complicate subsequent pregnancies, many women are able to have a vaginal birth after cesarean, VBAC, with proper planning and care. Emotional aspects of C-sections. There's a crucial emotional dimension to C-section births that often goes unspoken. Some women may feel disappointment or a sense of loss if they're unable to give birth vaginally, emotions that are valid and important to acknowledge. It's essential for families and medical professionals to provide emotional support and care throughout the process, affirming that all births, regardless of how they happen, are significant, transformative experiences. Preparation for a cesarean section. Preparation for a C-section, similar to any surgical procedure, requires some anticipatory steps. Dietary restrictions, usually fasting, are implemented 8 hours before surgery. The mother may also need pre-surgery tests such as blood work or other diagnostics. Prior to the procedure, the abdomen is cleaned and a catheter is inserted to drain the bladder. Furthermore, discussions about anesthesia options with the anesthesiologist are critical. Understanding what to expect can alleviate some stress and anxiety, hence comprehensive discussions with the healthcare provider about the procedure, reasons, potential risks and benefits are essential. Postoperative care and recovery. Following the C-section, the mother is usually kept under observation for a few hours. While recovery times vary, the hospital stay typically lasts 3 to 4 days. Pain management is a critical part of postoperative care, usually managed with prescribed analgesics. A balanced diet rich in fiber can help mitigate constipation, a common side effect of pain medications. Mothers are encouraged to walk as soon as they feel able to, as movement can help speed recovery and prevent complications such as blood clots. Risks and benefits of cesarean sections. C-sections can be life-saving procedures in certain circumstances, but they also carry their own set of risks. Potential risks for the mother include infection, excessive bleeding, reaction to anesthesia, and increased complications in subsequent pregnancies. For the baby, there's a slight risk of injury during the operation, respiratory problems, and lower OPGAR scores, which evaluate a newborn's health immediately after birth. On the benefit side, a C-section can prevent complications related to prolonged labor, distress for the baby, and potential risk of oxygen deprivation. Furthermore, it can be a safer alternative when the baby is in breech position, or for mothers with certain health conditions like heart disease. Statistics on cesarean sections. In the United States, according to the Centers for Disease Control and Prevention, CDC, data up to 2019, the C-section delivery rate hovered around 31.7%. However, the World Health Organization suggests the optimal rate for C-sections should be between 10% to 15% to achieve the best maternal and infant outcomes. Health status of cesarean-born children. While most children born by C-section are healthy, some research suggests they may have slightly higher risks for certain health issues later in life, such as asthma and obesity. These children may also have a lower diversity of beneficial bacteria in their guts due to bypassing the birth canal, which could affect their immune system development. However, these are areas of ongoing research, and it's important to remember that many factors influence a child's long-term health. In conclusion, cesarean sections are a crucial part of the range of birth options available to women today. While it carries both benefits and risks, careful consideration and discussion with healthcare providers can help ensure the healthiest outcome for both mother and baby. Above all, it's vital to remember that every birth is unique and every birth is a miracle, regardless of how it happens. Conclusion: the many roads to birth. Cesarean sections, while not without challenges, are a vital tool in ensuring the safety of countless mothers and newborns. They represent another avenue to one of life's most miraculous events, the birth of a child. Just as every child is unique, so too is every birth, and the journey, however it unfolds, is a profoundly personal and momentous one. As the curtain falls in the operating theater, a new story is just beginning, the lifelong journey of a new human being.